Okay, so we're going to do perineal exam and suture laceration repair. So here's my pelvis. The first thing is that you want to get in a comfortable position so that the client is comfortable, but also on a flat surface underneath their bottom, and so that the midwife can not only visualize but also maneuver agile, can be agile, have a good angle for that. So the first thing, we're going to just check for a laceration. So first I want to tell the client what's going to happen. I'm going to start at the top, kind of up by your clitoris, and just work your way down, examining the labia. I'm going to open. I might have to open the labia. There might be clots I need to move out of the way. There's nothing sharp, nothing poking. Communicate if it's not feeling good. And I'll stop and make sure that you're comfortable. So letting the client know, feel the gauze on their inner leg, and starting at the top, just where the labia insert, where they meet, examining the paraclitoral area, making sure that there aren't any tears in there or in the periurethral area, separating the labia, as needed. And then after examining that area, just moving down, especially through here, looking for any skin splits, looking to see if the labia, particularly the labia minora, if that has separated anywhere or been degloved. And then especially as we get lower, looking in on the vaginal walls to see if there's any bleeding, if there's any tissue that looks kind of meaty or raw. And in addition to doing a visual inspection, to manually feel for the integrity of the tissue. That can be a really important thing, especially when examining the vaginal wall. So as we get lower, especially down toward the perineum, looking for a split kind of in this area, seeing if there's a superficial skin split, and then to see if the laceration goes deeper into the vaginal mucosa and into the muscle tissue. And just examining, I want to be able to visualize the apex, see how far back it goes. And if I'm concerned, or even routinely, to do a vaginal rectal exam, just to see if, what the integrity of the tissue between the vaginal wall and the rectal capsule, the anal capsule. So this client, and this, I have a light here. It's helpful to have a light. Having an assistant hold that can be really helpful. So this client, we're going to say, has just a really minor second-degree tear, so that there's some perineal splitting right here, and then it goes back just a little bit, just into the vaginal, into the introitus, just, a centimeter. Not very much, but there is a little bit of muscle tissue, so I do want to put a couple of stitches into that to make sure that the tissue is approximated so that it can heal. I didn't mention earlier that I have on sterile gloves, and I was using sterile gauze. So now if you're going right into the suture repair, I didn't grab a syringe. But in this case, I'm going to draw up just a couple of milliliters of lidocaine. We like to swap out for a smaller syringe so that it's less painful for the client. But we also use a topical jelly, so a topical lidocaine jelly. So we just put a little bit of gel on here, kind of leave it on the tissue for a couple of minutes. It takes 90 seconds for that to kick in, so just so that prick of the lidocaine needle isn't quite as painful. Also, if there's a lot of bleeding, you can make a little tampon, and in our practice we usually just roll up a little bit of gauze and insert it, warn the client of what's happening, let them take a really deep breath, and that's just to stop any bleeding. And it's really important to remember if there's a tampon in there so that it can be removed after the laceration is repaired. But in this case, there's not a lot of bleeding, so we're not going to use a tampon. And we're going to, so we have needle holders. These are actually forceps, but, they can serve as needle holders. And have a suture. In this case, we're going to use, probably just a 3/0 CT2, just a nice small little needle, and suture. And we like to kind of put the thread through some lubricating jelly so that it moves a little bit easier. And so I'm going to start by taking my needle and putting it in, can't really see. So I want to go about put my first stitch into the apex of the laceration and do some surgical knots. So tying off, I don't have some thread here or a needle, but so tying that off, doing a few stitches, a few anchoring knots rather, right there, right at the apex. And then I want to do a stitch down into the muscle tissue, using some tweezers to catch the needle on the other side. And I'm just going like 1/4 of a centimeter into the tissue, just enough to catch. In this case, it would depend on, you know, how deep, if I needed to do a deep stitch and then do a superficial stitch. And so I'm going to do that, and because this isn't very deep into the, you know, into the vaginal wall, I really just need to do do my anchor stitch and then do one stitch to kind of pull the muscle tissue together. And then if it's needed, which in this case it probably is, just to pull the perineal tissue together, avoiding the hymenal ring. And just pulling that perineal tissue together. I want to make sure that everything's approximating, that I'm not leaving any gaps, that, you know, and it should just look like it all comes together really well. And then I want to, you know, kind of dive back under that hymenal ring and do kind of a final anchor stitch internally, so that all the knots and anything is internal and there's nothing hanging out externally. And then some some thread scissors to just very carefully snip for the client. I didn't explain about the lidocaine. I'll do that quickly. I don't have a syringe here, but so once it's full, in this case we'll probably just do a couple of places, and so you want to stick the needle in, maybe a centimeter or two, aspirate the needle to make sure that you're not in a blood vessel, and then slowly, as you're withdrawing the needle, disperse, maybe 1 or 2 milliliters of injectable lidocaine, and doing that on both sides prior to the laceration, and then waiting a couple minutes for that to kick in.